May we please request the participants to switch off their videos if you don't mind. And put yourself on mute, and we will have everybody will be able to log in their questions in the chat window, or raise your hand, and then we will let you speak and join and ask your question. So, good evening, everyone. And while we are still waiting for people to join, I just thought we will start with some introductions. So, I'm Archana Sharma. I'm the founder of Samvedna Senior Care. And I have with me here my co-founder, Dr. Jayashree Das Gupta. Jayashree is a clinical psychologist, and she's also the project director for Samvedna. So today's topic is no dementia, no Alzheimer's. And as many of you are familiar, Samvedna has been working in this area of dementia and mental health for the last many years. And we have various services and programs to help educate the family, as well as provide counseling services and interventions for the patients of dementia. So also I would like to add that this is next month in September is World Alzheimer's Month. And also as a part of that, the Alzheimer's Association, the international body, has this year's charter is to look at early diagnosis of dementia and what are the challenges and barriers. And that's what we are going to aim to address over the next 2 months. And we'll be doing various workshops and talks to address and answer the questions and the challenges, and see how we can help more and more people in this area. So, so welcome, Jayashree. Welcome. And I will just start with a simple question, Jayashree. I keep forgetting my spellings.
Yeah.
Is that a sign of dementia? I'm really worried.
I'm really sorry to hear that. I think this is something that a lot of people might be experiencing. But before we get into understanding whether that's actually a sign of dementia or not, I want to understand, are you experiencing some amount of stress lately?
Yeah, so when you're running an organization, there are a lot of stressors.
So then maybe this is a good time to use some of the other tools that we have to help us on the way for spellings and things. We shouldn't shy away from utilizing help where it's available.
Yeah, so things like spell check, Google spell check.
Absolutely, we must use those if we really need it.
And sometimes I look at my WhatsApp, and then I look at my email, and then I look at my WhatsApp, and then I don't know why I was looking at my WhatsApp for. So then it takes me about a minute or so to recollect that why did I open my WhatsApp? I think we're using too many forms of communication at the same time.
Possibly. I mean, I don't think this is uncommon. I'm sure there's a lot of our participants who are listening in who've also gone through similar situations. I think what you're describing is one of the challenges of multitasking and trying to do too many things at the same time, and finding it difficult to kind of pay attention to one. So, but I don't know. Let's talk about whether these are signs of dementia, and how we can really understand whether these are things. How concerned should we be about some of these things if we're experiencing them? Because I have to say these are things that are quite common. Yeah, I'm sure, myself included, I'm sure these are things that have happened to all of us at some point or the other.
Yeah, I just need a lot of reassurance from you. Okay. So over to you, Jayashree. I think why don't you start? This session is also being recorded, and And we are also live streaming it on YouTube. So in case any of your friends or family members who can't join, then I can share the YouTube link where you can see the video. So please, I'll be just sharing it shortly. So Jayashree, over to you. Please carry on. So
Achita, can I request you to allow me to share the screen?
yeah.
Thanks a lot. So, of course, we will. One of the aims of these meetings are to help address as many questions and concerns that people may have. And in case you wish to,
Just request everybody to please mute themselves.
thank you. In case you have any questions or that you'd like to ask, you can always type them in the chat box, or you can share them anonymously with the host, and we'll take them up. This meeting is being recorded, and the link will be made available, as Archana said, so you can share it with people who might not have been able to join today. So I'd just like to share my screen. And well, actually, I thought, Archana, maybe we could start with a question for all our participants.
Sure.
Do you think dementia is a normal part of aging?
Okay.
So this is
Can everybody see the question? Yes. So please do type in your answers.
So we'll give you, some time to just, put in your responses. Is dementia a normal part of aging? So I hope you've been sharing your responses. Great. So we have 82% of people who've responded feel that dementia is not a normal part of aging, and 18% who feel that it is a normal part of aging. And you're absolutely right. Dementia is not a normal part of aging. So what is it? Dementia is really it's an illness. It's considered to be a group of symptoms that are characterized by an overall deterioration in a person's thinking abilities. It has various symptoms, which I'll just talk about, which is progressive. It's a neurodegenerative disorder. It's an illness that impacts the brain. And what are the kind of things that we see as a result of this illness? So we see that there are changes in memory. People begin to forget things. They find it difficult to remember things that they used to know earlier. So there's a lot of memory loss. That's one of the most common symptoms associated with dementia. In addition to that, the very basic abilities that we use for everyday thinking purposes, how we plan, how we organize things, all of these also get impacted in dementia. And our ability to use language. So not only in terms of how we speak, what we, our ability to communicate, but also the way in which we understand spoken language or what we read. So our ability to actually comprehend something that somebody else may be telling us may get impacted. Or we may find that, we're having difficulty to make sense of reading something. So these are all common signs or symptoms that we see associated with dementia. And we also find that judgment gets impacted. So a person may know how to, what is typically considered appropriate or inappropriate in a particular situation. But as a result of the changes in the brain, their ability to judge this gets impacted. And because of that, there's also a lot, what you see really comes across as changes in that person's behavior or changes in their personality. Person may end up doing things that you would have never thought this person would be capable of doing earlier on. And we also find that because of the deterioration in the brain, there's a lot of impact on a person's ability to really understand where they are at a particular time, make sense of even day and night as the condition progresses. So yes, absolutely, as most of you responded correctly, dementia is not a normal part of aging, and we'll talk a little bit more about this going on. Some of these things you do see changes as we grow older in things like memory. And we may have other difficulties like we were discussing earlier that are quite common. But it's really important to understand that dementia is very different from the kind of differences or challenges that a person faces as they're growing older. And it is a new neurodegenerative condition. So let me ask you all another question. I'm sure all of you would have heard of Alzheimer's disease. So are dementia and Alzheimer's disease the same? I want you to just share in your thoughts about whether you think dementia and Alzheimer's disease are the same. So just put in your responses to the question. Are dementia and Alzheimer's disease the same? So I hope you put in your responses. We should get the results of the poll in a while. Let's see what most people feel. So again, 87% of people have responded by saying no. Alzheimer's and dementia are not the same thing. And again, you're absolutely right. Alzheimer's disease and dementia aren't exactly the same thing. Dementia is really an umbrella term which describes a variety of these symptoms that I mentioned earlier, which are associated with cognitive deterioration. And Alzheimer's is one of the types of dementia. It's in fact the most common type of dementia, which accounts for almost up to 75–80% of people with dementia. These people suffer from the form which is known as Alzheimer's disease. But there are many other types of dementia. And some of the other common names that you might have heard are vascular dementia, Lewy body dementia, frontotemporal dementia, Parkinson's dementia. So these are the different types of dementia. And the symptoms associated with each of these types of dementia may differ somewhat. As well as, but more importantly, the causes or the reasons behind these kind of types of dementia is the basis on which we kind of understand and classify the different types. So what we see is the kind of changes that are happening in the brain in Alzheimer's disease are different from those in vascular dementia, which is largely due to changes in the way that the blood supply to the brain. And Lewy body dementia, where a particular kind of deposit occurs in the brain that leads to a disruption in a person's ability to think and their cognitive abilities. And of course, frontotemporal dementia, where you see changes that occur in the front and the sides of the brain, and which is the reason why it's called this. In Alzheimer's dementia, the reason that we see for this cognitive deterioration is the formation of different plaques and tangles, and that's almost literally it's like junk in the brain that impacts the ability of the brain to function the way that it should, and that leads to these kind of symptoms where a person cognitive abilities begin to deteriorate over time. But one thing that's common across these kind of dementias is that they're all progressive. Unfortunately, right now, there's no cure for any of these kinds of dementia. And as the illness progresses to the advanced stages, which is typically beyond, usually it could be a slow progression, sometimes, across a span of 5 to 10 years, a person's independence gets completely impacted. So they become dependent on others for basic needs such as feeding, bathing, toileting. They may initially be aware of the kind of difficulties that they're facing, but over time, even their ability to understand that they're experiencing these difficulties also gets lost. And they just find it very hard to understand what's happening around them and make sense of their environment. There's also, in the case of Alzheimer's disease, very severe memory disturbances. And all of this impacts a person's overall ability to carry out day-to-day activities. And towards the latter part of the illness, most patients are, may even have bowel or bladder incontinence, may also even be confined to a wheelchair or the bed. So this kind of deteriorative process is something that's very common across all the forms of dementia. So I have another question for everyone who's listening in. And I want you to just guess, how many people have dementia across the world? What do you think would be your if I were to ask you to just take a guess, would it be 10 to 20 million, 20 to 40 million, or more than 40 million people who suffer from dementia across the world? So thanks, Archana, for putting up the poll question. Put in your responses to this, and let's see what most people have to say. So how many people have dementia across the world? So just put in your responses, and we should have the results up soon to see what most people feel.
We request you all to share your answers. There is no right or wrong answer. This is intended to create awareness.
So just put in your responses to the poll. We don't, this is the point of this, is to just see what most people feel. So do share in your responses. Do you feel, how many people across the world have dementia? I'll request if you can keep yourselves on mute. We'll definitely give you some time to ask questions in a while. So most people have responded, or this is quite close. People have said between 20 to 40 million. Could I request you to please put your mic on mute? Thanks. So most people have actually, it's close, between 20 to 40 million and greater than 40 million. 47% of people feel that it's greater than 40 million. And you're absolutely right. Dementia impacts people across the globe. In fact, there are more than 10 million new cases of dementia every year. And that amounts to someone in the world developing dementia every 3 seconds. So that's actually quite startling in terms of how common dementia actually is. Uh, what about dementia in India? So dementia in India is actually also quite common. We have more than almost 5 million people with dementia currently, and this number is actually expected to grow significantly to almost double over the next 10 years or so. Ironically, and this is something that we were discussing earlier on, most people with dementia do not even get a diagnosis in the initial stages. In fact, there's been some research that's been carried out in India, and this has shown that the treatment gap for people with dementia is 90%. So that means only 1 in 10 cases of dementia are actually getting diagnosed. And that means that people are not really able to get the benefits that various interventions can provide at the initial stages of dementia, as well as the kind of support that caregivers need for when they're caring for people with dementia. So I think this is something that we get asked a lot by people in terms of how do we determine whether what we're experiencing as changes in our thinking abilities, in our memory, is this actually a part of dementia, or is it not? Is it just a normal part of aging? Is it related to stress? How do I understand this? So this is really important, and it's something that I think is important for all of us to know, because you may face these concerns yourself. You may know of people who are experiencing these kind of difficulties. So it's something that you could share with them as well. We all forget names of people that we don't see on a regular basis, or we have these kind of experiences where you may know somebody, you may just have that name on the tip of your tongue, but you're not able to remember it. You may even remember what alphabet their name begins with, but you just can't get the name. And that's actually a very common, very normal experience. But if you begin to forget names of people who are close to you, maybe close friends or family members even, then that's a definite warning sign of dementia. And that's a time at which typically, it would be very important for other family members, if you're noticing someone is actually showing signs like this, it's essential that you bring them in for an evaluation. We all sometimes may forget directions, but a person with dementia gets lost even in familiar places. So we know of a lot of clients who've actually, been going regularly to buy groceries in the market, and one day they just get confused, they blank out. They're not able to find their way back home. Sometimes, people have also got lost because of this, and then someone else has recognized that they're, noticed that they're confused and help them get back home. So getting lost in familiar places is another warning sign for dementia. Again, having difficulty finding the right words sometimes. That's, again, something which is very common, and we all experience this at times. But I was talking earlier about language-related difficulties that are characteristic of the deterioration that we see in dementia. And a person with dementia often has difficulty finding the right words, but also often substitutes one word with another. So it becomes very difficult to sometimes understand what they're trying to say. Now, as a natural part of aging, we might feel tired, not feel like tidying things up. You just feel fatigued or not feel like doing something. But a person who has dementia becomes very disorganized because they find it difficult to make choices and decisions about how to manage things. Something as basic as something they were doing earlier, like even for a lady who's been managing the household or the kitchen for many years. Now she finds it very difficult to actually just keep things organized, and gradually becomes very indifferent about it. This may also result in signs of poor hygiene, just becoming very indifferent about not wanting to bathe or maintain personal hygiene. These are signs of dementia. Again, ability, we sometimes may not feel like interacting with others because we are feeling upset or have some low mood. Um, could I request you to please put your mic on mute, and we'll give you a chance to ask questions in a while. Thank you. But if a person with dementia usually shows a loss of interest in maintaining social interactions, and as well as sometimes socially inappropriate behavior, and also mood changes can be very unpredictable. So you may see that a person becomes irritable or angry, and it's difficult for family members sometimes to understand why they're reacting or responding in such a way to something, something that might not just make sense. So these are the differences between dementia and signs or experiences that we may all have as a normal part of aging. And it's absolutely essential that if you see a family member or a loved one, a friend showing any of these signs, that you actually bring them in for an evaluation to understand whether these are signs, the initial signs of dementia, or it could be something else also, or a normal part of aging. So that brings me to one more question that I'd like to ask you all. How can dementia be diagnosed? So, Archana, if you could put up the poll question for our participants, I want you to just respond to how you think dementia can be diagnosed. Is it on the basis of a medical examination, various brain scans? Is there a blood test? Are there cognitive or psychological tests? Or is it all of the above? So how can dementia be diagnosed? Please do share in your responses. Again, there are no right or wrong answers to this. Put in your best guess. This is just to help spread awareness, and hope that you can share some of the things that you learned through joining for this session. So do share your responses. How can dementia be diagnosed? Medical examinations, brain scans, blood tests, cognitive or psychological tests, or all of the above? So if you put in your responses, let's look at what most people feel. And we should, okay, so we have a majority of people saying cognitive or psychological tests. And then we have that's 63%, and we've got 37% of people feel it could be diagnosed either using brain scans or all of the above. Great. So actually, there's no one test to diagnose dementia. Usually, a combination of these methods are used to understand the level of deterioration that a person is going through and arrive at a diagnosis of dementia. And depending on the stage at which a person comes in for evaluation, some or all of these may actually be advised as part of the evaluation process. So, for example, when you meet any medical or mental health professional, the first thing that they will most probably do is take a very detailed clinical history and medical history. Really understand what are the kind of changes that the person has gone through, what are the other comorbidities that they may have. They'll do a medical examination, and this will help to arrive at a clinical diagnosis of the condition. Brain scans are useful in understanding exactly where the deterioration is in the brain, and also understand exactly how much of deterioration has happened. Cognitive or psychological tests are also very useful, and these really help to understand the kind of changes that have happened in the various cognitive processes that we were talking about that deteriorate in dementia. For example, memory or judgment or orientation, other planning, organizational abilities. So these really help to understand how much those have deteriorated, and also help to understand where more of the difficulty is, which of these cognitive functions are more difficult for the person. And this is also used as a basis to plan various interventions. Um, Now there are also some blood tests that are showing promise for in the diagnosis of dementia, particularly Alzheimer's disease. But again, this is more at a research stage. Accessibility to these blood tests is very limited. But as I mentioned earlier, there's no one test to diagnose dementia, unfortunately. And it's a combination of these different approaches that are used by a multidisciplinary team to arrive at the diagnosis and then plan for the kind of intervention that needs to be provided. So, what is the importance of early diagnosis? Well, I mentioned earlier on that there is no cure for dementia, which means, unfortunately, we can't reverse the deteriorative process that's happening in the brain. However, there we can do a lot to provide symptomatic relief. Medications can help with slowing down the progression of the illness, as well as can various stimulation therapies. Also, medication can be used to help with the various other comorbidities that a person may experience and the behavioral challenges. I spoke briefly about the kind of agitation that a person may experience. And these are some of the things that we can actually do to help people with dementia. Another thing that I think we all know as caregivers is that it's hard caring for somebody with dementia. And it's very important that we provide timely support to caregivers so they don't experience burnout. And there are some other conditions which may mimic symptoms of dementia. So it's important to get an early screening done and detailed investigations to understand if there is any reversible cause for the dementia. For example, vitamin B12 deficiencies, which can then be treated to actually help with these kind of symptoms. So I'm going to stop sharing my screen there. And if there are questions, I think we can discuss some of these right now. Okay, so I think we have some questions already, which I think we've addressed. So one of the questions that had come up from one of our participants is in terms of what are the telltale signs of dementia and the normal memory problems that an individual may have. So as we discussed earlier, the kind of difficulties that I showed in that table which I presented are the things that happen that a person who is maybe above the age of 60 plus may experience more frequently, but this is really then the difference between the kind of challenges that they're facing and the early signs of dementia. Arjun, I wanted to check if there are any other questions that you've received from participants so that we can take those up. And I encourage anyone to put in any questions that they have or even experiences that they would like to share about their caregiving experiences with dementia.
Yeah, Jayashree. So there is a question that I'm 71 years old and I go to the fridge and get something and I forget and close the fridge immediately. Then I remember what I had come for. So is that a sign of dementia?
So I'm sure there must be many people who've experienced this kind of challenge. Um, if this is happening and you're aware it's happening, um, that's okay. If it's happening so frequently that it's making it difficult for you to function, so you're finding you're going to the fridge and every time you're going, you're forgetting and you don't know why you went there, and then you have to go back, then there's probably something that you need to look at and do about it. It could also be that maybe you're thinking of too many other things at that time. You're not concentrating enough when you go to the fridge. If you're busy doing something else and then you're going there, you may forget. So if it's something that's bothering you, I would definitely say meet someone and just do an evaluation. But if it's something that's you're able to understand and it's not happening so frequently that it's troubling you, then that's okay. We all sometimes experience this.
So, Jayashree, the next question is, how long can a dementia patient be in denial before accepting that there is a need to get medical help? Very good question.
This is something that we see a lot um, during, this is a very common question that we have from people. A lot of patients with dementia are in denial because it's very difficult for people who have been very high functioning to actually understand and accept that they're experiencing these kind of difficulties. So as a result of this, a lot of them tend to, it's very normal for them to say that we're managing, we're doing something fine. And in a way, that's something that as caregivers, we need to encourage. So if you're asking in terms of an absolute time point, I don't think there is one, but it's something that's very common. And it's something that caregivers and family members have to be very sensitive towards. So rather than constantly reminding a person that they're actually have a problem and that they, and jumping into do everything for them, it's important that they help them to remain as independent as they can, keeping in mind that they're always safe, but encourage them to do whatever they can do for as long as they can. So nobody wants to give up their sense of independence, and that's one of the reasons why we do see a lot of denial or evasiveness in dementia.
So there's a very interesting question. Is it true that those who are absent-minded in their youth are likely to become dementia patients in their old age?
That's a really interesting question. I don't know if I have an answer for that, though. I definitely don't know if there are any longitudinal studies, I think, to actually say with certainty if that's the case. I can't recollect any, but I don't know if there's whether carelessness in your youth is something that predisposes you to be increases your risks for dementia. Although I can say this, that if when we think of carelessness, what are we talking about? Is it somebody who are we talking about somebody who drinks, smokes, doesn't exercise, leads a very erratic lifestyle? In which case, yes, because these are all risk factors for dementia. So, and these are what we call as modifiable risk factors. These are things that we can change in our life early on in our life that may reduce our risks for developing dementia. in our later years. So, for example, if you drink alcohol, it's important to minimize that. Do not smoke. Again, exercise is very essential, and nutritious diet. These are things that are important, and these are modifiable risk factors for dementia. So yes, if those are things that a person in their youth is careless about, maybe it does increase their risks for dementia. I think so do type in your questions, or even any experiences that you may have about caring for somebody with dementia, or if you want to share an experience, we'd be happy to.
So there's another question on OCD. Is OCD behavior linked to dementia?
It can be. Again, dementia can present in various ways. So you may see increase in some OCD type behaviors. Again, I'm not sure what you mean by OCD exactly, but one of the things that we often see is a person may be doing one activity repeatedly. If that is what you mean by OCD, it's possible that a person may not remember that this is something that they're doing or really understand how to break that cycle. So, for example, we often find that there may be somebody who is repeatedly cleaning or something, or saying they want to do something, but it's because it may be because they're not remembering that they have just done this, or they may start doing that particular activity, like cleaning something, and then find it difficult to even understand how to stop that and start to do something else. So I mentioned, like, even this basic kind of judgment or decision making and making choices becomes difficult. So actually, things that we do and take for granted, in our abilities to do are quite complex. So yes, OCD type symptoms can occur, and these kind of repetitive behaviors are very common in dementia because of this reason of just not being able to remember or break that cycle of what they're doing.
There is a question on would you recommend that primary caregiver who's a senior citizen himself or herself gets counseling and takes medicines to keep calm? So I think this is something we face a lot, right?
Absolutely. It's essential that if any caregiver is experiencing stress, it's absolutely essential that they seek professional support. Counseling is very helpful for that. And there's a lot of stigma about seeking help from a mental health professional. But I really want to highlight that caregiving for someone with dementia is not easy. It's can become very difficult. It can become very draining. It's very difficult to see a person whom you love, who you know who has been very functional, or someone whom you may have depended on throughout your life. To see them now deteriorating and start depending on you or look confused can be very, very emotionally traumatic and disturbing. It can also be very irritating to constantly do that, and to do it without any support can lead to a lot of burnout. It can lead to caregivers feeling low, even increased risks for depression. It can lead to them feeling frustrated. And all of this impacts their ability to actually provide care and be supportive to the person who's going through dementia. So counseling is very important. It's important to know that you can gain that sort of support from somebody else whilst you're caregiving for someone with dementia.
Yeah. So can you see the questions, Jayashree? I just made you co-host, so I don't know. But there's a question that I'm 46 and diabetic. I frequently forget the names of my friends and family members, and I also forget an important date in office. Is this a start of dementia?
Sorry, Archana, what was the age again? I'm afraid
46. 46.
46. Okay. I think because the age is 46 and it's young, I think it's important to go and get an evaluation done, because sometimes dementia can start in the 40s as well. And it's the sooner that it is diagnosed, the better it is, because you can start with the various kind of interventions that we were talking about in terms of stimulation and all to um, slow down that progress. Uh, this could also be because of other factors. It might be because of stress, or it could be because of something else. But because this is happening at a younger age, it's even more essential that you do meet somebody for a professional evaluation who will be able to explain to you what the reason for this is and determine that. And based on that, then whatever necessary course of action or intervention is required, you can do. So definitely, I would encourage you to go in for a detailed evaluation.
So the person is asking where he can take advice. So you can write in to us if you have want to go in for an evaluation. I'll just type in the email ID, and you can send us your query, and we'll be in touch with you. There's another question on are anger and anxiety with forgetfulness an indication of dementia?
Anger and
Anxiety.
anxiety. Again, anger, anxiety can sometimes increase in people who have who are at the initial stages of dementia, where they are really struggling to carry out their day-to-day activities, and they have this sense, they're aware that they are actually experiencing some challenges but want to hide this from others. So sometimes it's often the kind of becoming angry, or becoming, might be one way to kind of hide that. A lot of people with this initial stage do show increased anxiety, because it's just difficult for them to manage activities with the ease that they were able to do it earlier, and therefore they become more anxious for for when doing things, and overall in general. So again, if somebody is showing a change that's very visible to you as a family member, you feel that this is a person who never used to be so angry before, never used to be so anxious before, and now they're becoming more angry, more irritable, more anxious for everything, avoiding doing certain things, or becoming very dependent on others to do it for them with some or the other excuse, then I think it's really important to go in for an evaluation. Again, an evaluation will help understand what is actually going on. Is this actually a sign of dementia? Could it be related to something else? Or is there a need to really be concerned? The sooner a person with these kind of challenges, if it is dementia, starts to seek intervention, the better it is.
Okay. I think we have a time for a couple of more questions. And if anybody would like us to explain anything in Hindi, please do put in your request. We'll be happy to do that. So this is a question that my mother suffered a brain stroke during angioplasty operation, and her brain scan show infarcts. And now she wakes up sometimes as startled, anxious every 5 minutes while going to sleep. And her short-term memory seems iffy. So the doctor has probably diagnosed that dementia, but they are not able to pin it down. So I think we would advise them to come in for a psychological evaluation. I don't know. You can you answer that?
Yeah, I think it's important to to come in for a detailed evaluation, to understand. So there's two things. One is when there is a diagnosis of dementia, it's important to understand. I mean, that is one level of. I mean, it's important to first get that diagnosis. The other part is then what do you do about how do you manage the various challenges that come along with this. And a detailed evaluation, if you come in for one, can actually help understand how to deal with some of these things, the kind of anxiety that you're mentioning that's happening. What can the family do to support your mother? These are things that we can work with or look at and advise accordingly. So again, it's important to come in for an evaluation so that you can look more individually and see how to provide help.
Yeah. And there's a very interesting question. The patient is in denial, and this is true, I think, in India for almost, I don't know, Jayshree, if there's any global data, but the patient is in denial, and how do you get him or her to come in for an evaluation? So I think in India, it's a bigger problem because of the stigma, but
absolutely, and I think that's a really important question, and I'm glad that that we're discussing this, because it's absolutely essential that we really create sort of awareness where people don't find it stigmatizing to go in for an evaluation. There is why is there a lot of denial? Why is it that people hesitate to come in for a diagnosis or an evaluation, or even meet a psychologist, a psychiatrist? It's because there's so much societal stigma against it. It's essential. We do work, and this is very common, as Archana was mentioning. I think it exists across the globe, more than we acknowledge. It exists across the globe, but we at Samvedna, when we do assessments, we work with the family to help build that level of comfort when our care specialists do assessments and interact with the patient because of this. And our care specialists are trained to understand, how to be sensitive to the elderly's discomfort, really, with having this sort of an evaluation done. So that's really, really important. But then at another level, I think it's absolutely essential that we all break those barriers of stigma, because that's really the biggest reason why elderly are uncomfortable about coming forward for help, because it's they're concerned about meeting a mental health professional, or concerned about becoming a burden on the family. But earlier intervention, earlier diagnosis leads to earlier intervention, and that's more helpful. And we need to do our bit to make the elderly, feel more comfortable about getting an evaluation too.
I think, Jayshree, on the lighter side, actually, I don't know whether it's a lighter side or a more serious side. I think the cost of managing dementia, if we can highlight that to people, that how an early diagnosis can help delay the cost involved in caring for a person with dementia, and the associated stressors. I think that should also be a deterrent for people to come in for an early evaluation, and because how the social structures are changing, there's most of people are living in nuclear families or independently, and the burden of that caregiving will come on their spouses. So I think we have to, I think what we are going to be doing over the next couple of months is talking more about this subject. We do that on a regular basis, but since this is going to be our Alzheimer's month, so we will be propagating this more. And if any one of you here has suggestions on the kind of topics you would like us to talk about, to allay fears or remove hesitancy, any ideas, we'll be happy to take it up. We will be doing screening camps. Some of these online screening camps we can do for people who would want to get an evaluation done. Some of these will be free camps. So, it should encourage people to come forward and seek timely intervention.
Ma'am, can I ask a question?
Sure, sir. Sure.
Yeah, the question is just responding to the people not going for assessment. Unfortunately, when you go for assessment, the guy has given you 30 out of 30 in MMSE test. He's done a brain scanner, etc., everything. And yet the neurologist says, suspect, maybe. I mean, where do you draw the line? That's one. And the second question was, if it has been recognized the caregiver is burnt out, then there is a responsibility of the people, those who are talking about it. They need to do something, and that is not being displayed or done. So these are the two things which are, I think, very important, and people need to look at it.
Absolutely, no, I agree. So firstly, when we do an evaluation, as I was mentioning earlier, there's no one test to diagnose dementia, but there's a lot that can be done at the early stages. So it's important to work with the professionals who are doing the evaluations to understand what could be what is the level of deterioration, what could be the challenges that the person is facing, and to provide support. Like one of the things that one of the reasons why we run these support groups is also to not only create awareness about the illness, but also to help people who are caregiving for dementia understand that there are more people who are that it's not so uncommon. It is something that is common. We need to talk more about it. There are others who are sharing going through similar experiences. And today, of course, we're focusing a lot more on the importance of early detection and diagnosis. But some of the topics that we've also covered earlier are about specific caregiving challenges. And support groups are a great place to understand from others who are sharing similar experiences about things that you can do to get support or other ways that you can deal with some of the challenges that you're experiencing as a caregiver. So I think that's really important. And I definitely, I mean, thank you for highlighting that. I think it's really important that we do much more and we really, as a society also, to extend that sort of support for people with dementia and their families. Archana, are there any more questions?
Yeah, so Colonel Sridharan is asking, is there any online support group for primary caregivers? Yes, sir. So actually, this itself is a platform for any primary caregiver to come in and ask their questions. And we do run these sessions regularly, once in 4 to 6 weeks. We also have individualized counseling available for primary caregivers if they would like to have individual session. Today's topic is more about awareness, but there are other topics where we really encourage primary caregivers to come and share their questions so that we can address them and answer them.
Archana, also, maybe I could just mention here that we will be starting some support groups for individuals. I think, Archana, if you want to talk a bit about that, we'll be sharing, a form to just kind of understand the needs that you may have and what would help you. And we are also going to be starting some more closed support groups for caregivers going forward.
Yeah, that's right. So, like Jayashree has mentioned, these meetings are open and they are open to anybody, uh, by invitation or otherwise, whoever has access to the link. But we are also realizing that many people probably, want to uh, get some specific questions answered, and we are looking at closed support groups, which are going to be smaller groups of 4 to 5 people, and which would probably run as a program, as a workshop for maybe 4 to 6 weeks, addressing different aspects of, whether it's mental health related issues or caregiving related issues or elder care related issues. So we would be running closed group support meetings for families and individuals. And we will be rolling out a survey to assess what kind of support people are seeking. And based on that, then the support groups would be rolled out. So you can watch this space for the link to the questions and the survey. And please do share your feedback so that we can structure the programs according to the needs of the families and the individuals.
And I think when you receive that, also do share that with other individuals who you may know are providing care, but who may not have joined like this meeting or have access to that link, because then those closed groups are really to provide more individualized support for caregivers or individuals with, who want some additional support for their mental health during these times.
Okay, great. So unless there are any other questions, I think we can wind up this session. Thank you everyone for coming in. And we are also looking at any dedicated communities of senior citizens, where they would, if you would like to invite us to be providing, conducting these screening camps, we will be very happy to do that. The medium would be online, but it would be structured in a way that, it will be one-on-one, and we'll be able to facilitate that. So please do write in to us if you have such communities, whether it's your neighborhood or it's your care home or any other RWA or club. We'll be happy to talk to you. So do write in to us. Thank you, Jayashree. Thank you, everyone. Have a safe weekend and a good Friday. I hope you enjoy your evening. Thanks all.
Thanks a lot.